Great. Hello, friends. Good morning, everyone. Thanks for joining us at this first annual SIPP Virtual Conference. My name is Zach Shearer. I'm a statistician in the Program Participation and Income Transfers branch here at the Census Bureau. And I'm really excited to be chairing our session this morning on families and poverty. I think this is a great session that really highlights a lot of what we can do with SIPP. We have two great papers to present for you today. We're still working through some technical difficulties with one of our presenters, but I'm excited to kick things off with these two great presenters and two great discussants as we get the conference underway. I know there's a lot of exciting topics to learn about the next 2 days. And so we'll do the presenters, then we'll do the two discussants, then we'll have plenty of time since we only have two papers in this session for your questions and for your comments, which I'm looking forward to fielding at the end. As I think you heard in the instructions previously, you can leave comments in the chat that we can sift through once the presenters and discussions have finished. Or we can also come off mute. At that point, Greg will be able to unmute you and we can hear your comments verbally for our panelists and discussants as well. But without any further delay at this point, I'm going to turn it over to our first presenter, Luis Basurto from Duke University, who is going to give our first paper today. So Luis, the floor is yours.
Awesome, thank you. Great, slides are up. All right. Good afternoon, or I guess good morning, evening, or everyone. I woke up not too long ago. So my name is Luis Basurto, and I'm a research associate at the Center for Child and Family Policy here at Duke University. Today, I'll be presenting joint work with Professor Lisa Janetian titled Income Benefit Workers, Practices and Experiences and Program Uptake, a look at Latino families. And before getting to the main presentation, just a few thanks to the National Research Center on Hispanic Children and Families, as well as the W.T. Ground Foundation for their financial support to get this project off the ground. And a shout out to our team of Duke RAs, Jess and Carlos, who helped process a lot of data to make this a reality. And then a few more, just thanks to Santiago D'Ambrosi, Megan Fino Velasquez, and Caroline Barnes for their immense contributions laying the foundations for this project. The last thing I'll say before I start is that for the presentation, I'll be using terms like Latinx, Latina, Hispanic interchangeably, but we do acknowledge that these are heterogeneous community with rich and varied histories and identities across regions and generations. But for the purposes of the talk, we'll be using these terms interchangeably. Okay, next slide. All right, so according to the most recent census, Latino children comprise more than 1/4 of the total children in the United States. However, Hispanic families have experienced rising child poverty rates during the first decade of the 21st century. For families residing in poverty, income support is positively associated with children's well-being. And yet, despite high rates of poverty, Hispanic children are less likely to receive support from means-tested programs. This could be for a few different reasons. It could be because Hispanic families face challenges related to household composition, language and literacy barriers. It could be related to like complex relationships and or citizenship status of household members, among other things. Others have shown that Hispanic families are also less likely to receive unemployment insurance and to file taxes and receive refundable tax credits, even though they have higher unemployment rates than peers. And also recall that despite representing one of the groups most affected by COVID-19, Hispanic families were less likely to receive the first round of economic stimulus benefits. Next slide. Okay, so economic hypotheses regarding time and related education and information constraints posit that efficiency of screening will also effectively allocate scarce public funding to families. The framework of behavioral economics, however, stresses that the context of poverty and financial instability taxes cognitive bandwidth and related attentional demands that can disrupt participation in programs despite intentions. Political science theories of administrative burden offer yet another complementary perspective related to the psychological compliance and learning costs, intertwined with the design and structure of public programs that act as facilitators or barriers to access and use these programs. Our research agenda aims to inform how state and local policy provision and practices have affected the well-being of Latinx families and children in the context of this unfolding narrative. So, as we mentioned on the slide, we incorporate both policy design and implementation into our framework. Okay, next slide. Awesome. So in this figure, we show the theory of change that guides our work. So for now, if you focus on the right side of your screen, this represents how current literature conventionally focuses on household income and connects it with children development. Now, looking to the left side of the screen, our contribution to the literature is twofold. So number one, we focus on policy design and practice, not just the availability of programs, and thread the needle between that, household income, and children developmental outcomes. And secondly, we do this specifically for Latinx families with their specific characteristics in mind. Next slide. Okay, so here we have, we are zoomed in on that left side of the chart that I just showed you. The idea here is to connect policy design or intent and policy implementation to household income. These policy characteristics may serve as a facilitator or a barrier for benefit receipt. Then from there, the next step is simply connecting benefit receipt to household income. Today, we will focus on everything up to benefit receipt. So you may think of this as a first stage of sorts. Next slide. Okay, so our research questions are, what are the perspectives of income benefit practitioners who serve Latinx families? And how do state income support policies and practices affect Latinx utilization of government benefits? Next slide. All right, so to tackle these questions, we administered a 20-minute digital survey through Qualtrics from May to September of 2020. And we primarily asked questions about practitioners' practices and perspectives in 2019. Now, I know when I say this, people always think that I'm about to capture something that happened during COVID, but the answer is no. Everything that we talk about today will be pre-pandemic. So at the beginning, we cast a wide net and reached out to states with the highest population of low-income Hispanic children. And after many months of back and forth with state representatives, we managed to successfully administer the survey in the 11 states that you see listed in the second bullet point. So the survey itself captures 6 themes: organizational processes, which includes things like language barriers, application processes, requested documentation, etc., training staff development, economic climate and budgetary constraints, demographics, office space, and its external political environment. Something important to mention here is that administrators and frontline workers got 2 different surveys. Many of the questions obviously overlap, but some of them are role specific, which is why they're different. Okay, next slide. Okay, so this slide shows how each state had a slightly different strategy to disseminate the survey. Some work through listservs, some gave us names, some let us directly email practitioners, and some states did it themselves. Some states had a more rigorous review process for the survey than others, and some had specific language that they wanted included in the survey. And I think it's funny that this is only one slide of the presentation, but it represents the majority of the time invested in the project, just talking to experts and top administrators from several states. I also want to mention that we agreed to share back data findings with the states, and we are currently in the process of creating these state sheets that we'll be sharing with them. Next slide. All right, so here After all, we ended up with 882 respondents across 11 states where we administered the survey. Of these, approximately 2/3 were respondents, or the respondents were frontline workers. And here on the map, you can see the counties from which we received responses, which represent, you know, the vast majority of high density Hispanic areas in the US. Next slide. Now, due to the way that the survey was rolled out, it's hard to think of response rates in the traditional sense. So here are two ways to think about external validity in the last two rows of this table, of the bottom table. The first one is that we capture respondents from the right places. And the second one is, did they complete the survey? And as you can see, we think we did pretty well given the complexities. We have completion rates as high as 95%, and the lowest here seems to be around 50%. So at this point, we have all this data about practitioner views and perspectives, and we then have to create constructs that reflect income benefit workers' experiences and perspectives as they relate to themes that may impact public benefit uptake among Latino families. Next slide. Okay, so I love this slide. So in order to create these constructs, we use a data reduction technique called Kramer's Fee. Some of you may be familiar with it, but this basically is a measure of association between variables that is based on the chi-square statistic. Now, this was what R spit back to me when I decided to run this technique for the entire data set. And while this is completely unreadable, I only show it to you so that you get a sense of two things. First, how we structure the survey. So it makes sense that we have these blocks of dark blue along the diagonal because these actually map to a section of the survey. So in a way, it is comforting to see that this worked as planned. And secondly, you can see that some of these individual questions are highly related, which is good news because we can use that to create the constructs that I keep talking about and I'm about to show you. Next slide. All right, so these are the explanatory variables we're going to use and what they represent. Here we have things like total number of documents requested during application. This is an additive measure that is constructed from 11 individual items where practitioners simply answer whether or not they request things like the applicant's social security number, their birth certificate, bank statements, etc. We also ask if they request the same things, but from other household members. So in the future, we could split this measure into documents requested from applicant only versus documents requested from other household members. We then have frequency of documentation and eligibility trainings. Once again, an additive measure from 3 questions that tries to get at how often staff are updated or reminded about, as the name suggests, and as the name suggests about documentation they should request and who is eligible. We also have the intercultural effectiveness scale, the very last row on the table, which was developed by Portal and Chen. This scale measures the level of intercultural communication competence using a 5-point Likert scale containing 20 items. So this instrument includes 6 factors, which are behavioral flexibility, interaction relaxation, interaction respect, message skills, identity maintenance, and interaction management. Due to the way that it's scored, the minimum score is a valid response is 20 and the maximum is 100. So, and here, lastly, just to know, the IES scale was only answered by frontline workers, whereas all other variables were described here were answered by everyone that took the survey. Okay, next slide. Okay, yeah, so here, I'm actually going to skip this slide. I'm going to go through a few interesting descriptive stats, but I feel like the distributions are a bit more revealing. So for example, here we have the number of documents collected during application. You can see that most people seem to have collected all 11 documents that we listed, but we see a distribution across this. Interestingly, we see that some people collected 0 or 1 documents. So you know, this is we have to look more into this, but this is what it looks like right now. Next slide. So emphasis on Hispanic representation among staff. This basically reflects how administrators thought, or how much emphasis they put on hiring Hispanic staff. So here we can see that a lot of them placed a lot of emphasis, and a lot of them did not pay, like put a lot of emphasis on this specifically. Next slide. Okay, so this is really interesting to me. We see this nice almost normal distribution here. I think once we get to the regression, you're going to see well, this is something we're still trying to figure out, and I guess just as a preview, we thought that a higher score of intercultural effectiveness scale, you know, the hypothesis there is that applicants would maybe be a bit more comfortable, and so maybe that would lead to like a positive association between this and receipt, and it does not as of now based on our models. So this is something that we're still trying to figure out. But anyway, I'm just getting ahead of myself here. This is what it looks like right now. As again, a lot of people scoring the highest, but it seems to be sort of normally distributed around, what is that, 75 being the mean. So next slide. Okay, so after all that time spent talking about the right-hand side variables in our regressions, we finally get to the SIPP data. So in essence, we merged our survey data to 2019 and 2020 SIPP data by state. Originally, we were going to merge this to 2020 SIPP data only, but because the pandemic happened, and as I'm sure you all are aware, we're discouraged from using 2020 SIPP data by itself. So here, our unit of analysis is family years, which I'll simply refer to as families. And we focus on families with children residing at or below 250% of the FPL. Here, I'm showing you two columns, Hispanic and non-Hispanic, and just some descriptives about the families. I do want to be clear, though, that we will not be comparing between these groups. This is not a comparative analysis. But rather we include the non-Hispanic column as a check to our work to put in context what we're seeing, and to put in context what we're seeing with the Hispanic sample. So one would expect, for example, the row that says any parents speak English less than well to be higher for Hispanic than non-Hispanic. And we do see that here. So we end up with 893 Hispanic families and 956 non-Hispanic families. Okay, next. All right, so our left-hand side variables, which come from the SIPP, include any public assistance, TANF, SNAP, or Medicaid, TANF or SNAP only, and Medicaid only. So these three are binary variables equal to 1 if the family received such benefit and 0 otherwise. As for the analysis itself, we use a simple fixed effects linear specification. We include state and year fixed effects, and here vector D contains all the measures that we described about provider perspectives and practices, and then a bunch of covariates that include some of the things that you saw in the previous slide. So next slide. Okay, so I guess before I go through the results, let me just briefly tell you our hypotheses. I think I mentioned one of them already, but I'll just give you a couple to put in context here where we see. So we expected that a higher number of documents requested would be associated with lower receipt of benefits due to increased administrative burden. We also expected, as I said before, that IES would point to a higher intercultural communication effectiveness. And so, as I said, maybe families would feel more welcomed or something. and that would in turn lead to higher benefit receipt. However, looking at this table, if you look at the second row, that 0.480, so these are odds ratios. So basically, this is saying that the number of documents collected during application is negatively related to receipt of TANF or SNAP. And on the very last row, this one checks out with what we thought, right? But the last one, the composite IES, it also seems to go in the negative direction here, which is not what we expected. So this is a counterintuitive finding that we're still trying to, think through. So, and maybe for this exercise, basically what we did is that vector D that I talked about only has one component, right? One element. So we ran individual regressions here. So the next slide shows that we combined all these, we combined all these constructs into one, sorry, 1 second. For anyone that has ever had one of these things in your office, it turns off if it doesn't see you moving for a bit. So that's what just happened now. Apologies. Okay, so yeah, so here we throw all the variables in the regression, and we run it for the 3 different left-hand side variables that I mentioned earlier, but we also run it for the different groups of Hispanics and non-Hispanics. And actually, the next slide, I think I highlight some stuff. Yeah, perfect. So, okay, so yeah, here again, it's just very puzzling. And we, in case it is not obvious, this is all work in progress. So we welcome any thoughts of what could be going on here. But so, for example, we see an effect, a positive effect of the composite IES for the non-Hispanic sample, as we mentioned, or as we thought would happen for the non-Hispanics. But then for Hispanics, we see a negative effect when it comes to any public assistance, or a negative relationship when it comes to any public assistance and TANF or SNAP, in a slightly non-significant one for Medicaid only. So very, very confusing stuff. But for example, here, one thing that, for example, frequency of documentation and eligibility trainings has no significant association in the non-Hispanic sample for any of the left-hand side variables, but it does for any public assistance and TANF for SNAP among Hispanics. So basically saying that a higher frequency of documentation and eligibility trainings is positively associated with receipt of any public assistance or TANF for SNAP. So anyway, again, still a lot of work to do, but in the next slide, I think, yeah, so here I just summarized the results. I know reading regression tables is sometimes not the best way to absorb everything. So the following measures of practitioner perspectives and practices are significantly associated with higher odds of TANF or SNAP receipt among Hispanic families. So we have level of outreach and awareness efforts. We have frequency of trainings and on documentation and eligibility, and then the number of co-located services, right? And in contrast, the measures associated with lower odds of receipt are number of documents collected during application, safety elements in the physical office space, emphasis on Hispanic representation among staff, ease of program navigation for Hispanics, and average intercultural effectiveness scale score. So, and lastly, when trying to disentangle these associations from one another, frequency of documentation and eligibility trainings seems strongly associated with positive receipt among Hispanic families. Next slide. So again, work in progress, but next step here, we have, we want to supplement our practitioner perspective data with the policy regulation information from each state. So if you remember at the beginning, I showed you two boxes. One of them showed policy implementation and the other one policy intent. So we're currently collecting policy intent information. So basically that just means we're doing a policy scan and collecting this information from state websites and stuff. So then we also want to merge this with racial and ethnic composition of human services workers in each state using EEOC data. And we'd like to supplement self-report data on income benefit receipt from the SIP with analyses of administrative data to assess relationships with the racial composition of benefit recipients. Another thing that we are not mentioning here is that we currently are doing this with SIP, and we will also be running this with the CPS just to compare what comes out of these. And lastly, further refine and investigate differences by race and ethnicity of families and communities. Next slide. Cool. All right. Well, that's all I have. Thanks a lot, and I'll stick around for questions later. Thanks.
Sorry, it took me a second to get unmuted there. Thank you, Luis, for your presentation. That was great. And I'm next going to turn it over to our second presenter today, who is Dr. Tapas Paul, who's going to give his paper, and then we'll hear from our discussants after that and field questions. I know I saw there were a couple in the chat already. We'll field questions at that point. So I'm going to turn it over to Tapas if you want to unmute yourself, and I'll control the slides as you present.
This is certainly good morning to you, but can you hear me clearly? Okay, thank you. So I'm another part of the globe. This is from Bangladesh. I'm Dr. Tapas Paul, working as an assistant professor at the North-South University here in Bangladesh. And today I'm going to present one of my papers, one of my research findings. This is about the impact of married women's labor market participation on poverty during the Great Recession. You can stop me at any point if you want, or certainly we can. I am here also to answer your questions towards the end of my presentation. Perfect. So during the Great Recession period, the poverty in the United States that rose dramatically, and this means if we look at the statistics, poverty in the United States during the Great Recession, according to the official measure, during this Great Recession period, poverty showed an increasing trend from 13.2% in 2008 to 14.3% in 2009. Poverty reached a record high of 15% in 2012. And during this time period, declining income share of the young people, also at the same time, less educated households suffered the most, as we all know. Wives of unemployed husbands joined the labor force, and this is known as the mancession there, and wives served as insurance in dual earner families. Certainly, the breadwinner, if this is the husband, in absence of his job, the wife is moving forward and joining to the labor market. Working wives' contributions saved families from the falling into poverty. They also maintained consumption is smoothing for their families. Next slide, please. If we look at the literature review, there are some interesting facts during this time point, but I'm going to a little bit previous years in terms of the income inequality differences by time period. I want to compare from 1950 to 1975 vis-a-vis 1977 and 1999. So after tax, median family income jumped by 208%, or this is up by 3%. The Gini coefficient, measure of inequality, that dropped by 6% up to 14%. And during the Great Recession of these different time points, not the Great Recession, during these different recessionary points, from 1974 to 75, 82 to 83, 1990 to 1991, poverty has gone up during the time points. Next slide, please. The women's labor force participation that increased since 1970, mostly for women who raised the children. And during this time period, after that time point, gender gaps in the labor market participation have decreased. Level and distribution of income for married couple families and single female-headed families have changed during that time point. At the same time, what we observe during that time point, increased wives' employment reduced the growth of family earnings inequality, which means earnings inequality for families reduced due to the increased employment by married women. At the same time, college-educated wives and husbands' earnings played an essential role in reducing the income inequality. Next slide, please. The central question here is, for my research, what is the purpose of the study? And I can claim that no study relates poverty to the added worker effect. And as we know, the added worker effect, this is basically trying to tell you the husband, in absence of the husband, the wife is moving forward and participating in the labor market here. One of the early papers, Ketan 1998, is the only paper that looked at the effect of working wives on poverty, but has important methodological shortcomings. In contrast, the current study examines the direct tie between a wife's labor force participation and her family's poverty status there. This study reports exactly what happens during the Great Recession in terms of wives' monetary contribution to the family. Next one, please. My research question, yes, I'm trying to investigate the impact of married women's labor market participation on poverty during the Great Recession there. This is our central question in my research. I want to see the poverty consequence there. The next step is my data collection and analysis. In the data collection process, in addition to the SIPP survey data, we calculated the federal and state income tax liabilities and the federal social insurance taxes using the NBER tax simulation method based on household income and demographic data from the SIPP survey. The data is coming from primarily 2008 SIPP data there, and as I said earlier, tax simulation model to estimate the household taxes as a secondary source for me to support my analysis. And what I'm using, certainly I'm using two different measurement methods of poverty. The first one, as we know, this is our official poverty measure. Historically, it goes back to 1960s. And official poverty measure, according to this measure, this poverty on an income threshold of 3 times the cost of the thrifty food diet to account for other family expenses. And the supplemental poverty measure, this is telling us, this uses information about what people spend today for basic needs, as that includes the food, clothing, shelter, and utilities. Next one, please. Thanks. And here, as we are, I went a bit further. In terms of the official poverty measure, is often criticized because it is based on a threshold of income that fails to capture available family resources. The official poverty measure is based on families' pre-tax money income, which fails to account for tax liabilities. The Social Security and Medicare taxes are particularly important for families with low incomes who have only earnings, and doesn't include the earned income tax credit and other tax credits and non-cash benefits such as food stamps, housing, or school lunch subsidies, or even public health insurance there. A second limitation of the official poverty measure is it is often argued is that it incorrectly assumes an equivalence of family members regardless their ages. One of this paper, Bishop and others find that adding a child and adding an adult to the family are different in terms of their effects on family needs, according to the official poverty measure. In addition, when a family has their second child, it adds more to the family needs than their first child. From a policy perspective, recent major anti-poverty policies are not reflected in the official poverty measure due to growing importance of EITC benefits, child tax credits, and Medicaid. The growth of the food stamp program, now the Supplemental Nutrition Assistance Program, SNAP, is also important. And as we all know, 15.5% of households in a month receive school breakfast here. 36% of the family months in the sample receive school lunch. Housing subsidies and low-income home energy assistance programs are there, and that omitted because SIPP has no detailed information here in my analysis. And the recessionary period that I'm covering here, certainly the Great Recession I'm addressing, and only 18 months I'm covering starting from December 2007 until the May 2009. A maximum amount of 2,840 of the SNAP payment that is received during this time period, and 219 for the week program for a family in a month. These are the additional informations I'm providing you to get some good sense for the analysis. Next slide, please. Okay, so regarding the data collection, as I was telling you, the 18 months data are there. And as you can see from this figure, this is the figure one shows the percentage of families in poverty for each calendar month of the survey based on the official poverty measure and supplemental poverty measure, and identifies the impact of the wife's contribution to family income on poverty. I measure total family income in two different ways. In the first, I include total family income that includes all earned income and other income in order to determine whether the family is below the poverty line. In the second measure, I subtract the wife's earned income from total family income to calculate the potential poverty status. As you can see from there, on average, 9% of families were below poverty, the first line, certainly from the horizontal axis. And poverty increased by 22% from May 2008 to August 2010. The omitting wife's earnings, 18.6% of families would be in poverty over the sample period, the third line. This is referring to us. Can you go back, move to the next slide? Okay, regarding the methodology and study design, the paper here, the research that I'm investigating, this is basically using the Blinder-Oaxaca decomposition framework. And in equation 1, I'm trying to do some decomposition setup where the DP, the left-hand side variable, is the effect of wife's earnings on the level of poverty for families. And PNW, this is the potential poverty level of families based on income after subtracting wife's earnings. The other one, P, this is the poverty level of families considering all income actually received by the families. Equation 2, where I'm trying to do the effect of wife's earnings on family on poverty level on the family unemployed households. Unemployed husband, only the unemployed husband there. The left-hand side identifies the effect of wife's earnings on the poverty level of families where the husband was unemployed, as I said, and this P, H, U, and W defines the proportion of families in poverty where husbands were unemployed and subtracts wife's earnings from total family income. PHU is the proportion of families in poverty with unemployed husbands considering all income including wife's earnings. Equation 3, the left-hand side that defines the effect of wife's earnings on the proportion of families in poverty where the husband was not in the labor force. P and W and PH and W, this is the proportion of poverty when the husband was not in the labor force and wife's earnings are subtracted from family income. PHN is the proportion of families in poverty when husband was not in the labor force, but considering all income for the family. Equation 5 with the same structure, where the left-hand side defines the effect of equation 4. The left-hand side defines the effect of the wife's earnings or the proportion of families in poverty when the husband was employed. Equation 5, the last one, is in any month T, any month during the Great Recession period. For those households, the husband must be either unemployed, not in the labor force, or employed. These three categories, one of the three could be. Where PHUT is the proportion of households in month T where the husband is unemployed. PHN, this is the proportion of households in month T where the husband is not in the labor force. The other option is the last one, PHE. This is the proportion of households with employed husband in month T. Next slide, please. Okay. And by assumption, I have few assumptions here, and I should introduce to these assumptions to my audience. The standard assumption used in this decomposition is that the outcome variable dpt over dpt prime is linearly related to the covariates in my analysis. Assumption 2, the second assumption, mutually exclusive groups. The population of households based on their employment status can be divided into 3 mutual exclusive groups: employed, unemployed, or not in the labor force. Assumption 3, structural form. A worker I belonging to either group employed or unemployed or not in the labor force are functions of the worker's observable and unobservable characteristics. But there is one problem with the above, which is that PHU, PHN, PHE, this is 1. Because we sum up to this proportion, it should be 1. So these 6 components are not independent. And one way to solve this problem is to take changes in households' unemployment status and not in the labor force status as related to employment. We can do this by substituting for PHE. This is equivalent to 1 minus PHU plus PHN. If we do this and rearrange, then we can get this decomposition equation there. And this is my final equation for the standard decomposition from the Oaxaca blinder decomposition approach. Next slide, please. Now I'm moving to the result part, and this is the effects of wife's earnings on the level of poverty based on the official poverty measure. The effect of wife's earnings on family poverty is defined by the difference between the percent of households in poverty taking account of total family income and the percent of households in poverty omitting wife's earnings. The effect of wife's earnings on the level of poverty where the husband is unemployed is much larger than the population as a whole. Average effect is 32.1 percentage points for the sample period. And due to wife's earnings, approximately 10% of households are out of poverty during that time point. Without a wife's income, household poverty would be substantially greater. Next slide, please. Here, I'm trying to portray some of the results from the decomposition analysis. And table shows the official poverty measure decomposition of the effect of the wife's earnings by husband's labor force status based on methodology developed earlier. The change in the effect of wife's working on poverty can be factored into 5 different components. Monthly values are calculated relative to May 2008, which I call T prime here in the decomposition. The numbers in the total change in poverty due to wife's earnings in that last column are the difference between the impact of wife's earnings on poverty in the month in question relative to May 2008 T prime. For example, the number in the February 2010 is 2.15, and this is the difference in the impact of wife's work on the poverty level in poverty 2010 relative to May 2008. The poverty level in 2008 was 16.94. Having a working wife decreases the poverty level by 16.94 percentage points, and that increases to 16.69 percentage points in February 2010. The poverty decomposition shows that the total effect of wife's earnings is greater in the later month of 2010 than the beginning month of 2008. Generally, in terms of family poverty reduction, wife's earnings are contributing more at the end than in the beginning months in our observation window. This is more practical and make more sense in terms of the way the family were adjusting to the poverty. Their income is smoothing. Certainly the later months of the Great Recession, they have much more experience what to do, what not to do, such a way they can formulate their strategies. In contrast to the official poverty measure, poverty decomposition based on the supplemental poverty measure shows a smaller increase in the contribution of wives' earnings. As we pointed out earlier, government in-kind transfer programs may contribute to poverty reduction in families under the supplemental poverty measure, with the result that wives' earnings contribute less. Using the supplemental poverty measure, we found a similar contribution of the wives' earnings due to the change in proportion of unemployed husbands. The decomposition using both official poverty measure and supplemental poverty measure suggests that the wife's earnings are particularly important when her husband is unemployed. The decomposition results show that the decline in the proportion of husbands, not in the labor force reduction, the importance of wife's earnings. And I conducted robustness checks with 2 additional specifications of the standard decomposition from a variation of the Waka-blinded decomposition. In particular, I considered an alternative supplemental poverty measure where I omitted taxes, and I considered a version where I omitted SNAP payments. The signs and approximate magnitude of our main results are not altered by these changes. Estimates are robust to numerous sensitivity analysis. And my bottom line is the poverty decomposition shows the total effects of the wife's earnings is greater in the later month of 2010 than the beginning months of 2008. Next slide, please. I'm here at the conclusion part of my analysis. The study found that wives' earnings make an important contribution to their family welfare during the Great Recession period. And the study uses the official poverty measure as a conventional and widely used poverty measure and a new supplemental poverty measure, SPM. The SPM confirms that transfer and liabilities by these measures may largely balance out, so the difference has little impact. And replacing the official poverty measure analysis with the SPM doesn't alter the main findings of the study, as I claimed earlier. Overall, these findings provide evidence that wives' labor market participation works as insurance for low-income families, suggesting that policies to encourage and facilitate women's work will reduce the poverty. As the study findings confirm the importance of wives' employment, they underscore the difficulties that poor families faced during the COVID-19 recession, in which employment for women was practically hard hit, and policies that facilitate wives' provide for families, specifically during recessionary downturns in that time point. So this is all about my presentation. I'm here to answer any question that you have. Thank you very much, Jack.
Great. It's faster on the unmute button that time. Thank you, Tapas. That was great. Thanks to both presenters for your papers. Now we'll get some thoughts from some folks from the Census Bureau on these 2 papers, both from our Social, Economic, and Housing Statistics Division. First, I'm going to pass the mic over to Mehreen, who's going to talk about Lisa's paper. So, Mehreen, the floor is yours.
Great, thanks so much, Zach, and thank you to both of the presenters for some really interesting presentations. My name's Mehreen Ismail, and I am a survey statistician in the Journey to Work and Migration Statistics branch here at Census. And I was delighted for a chance to read Luis and Lisa's paper. Before arriving at Census a few months ago, I spent about a decade working on SNAP, and I got my start in my career working on application assistance, helping families apply for the program. And that experience taught me a lot about what households encounter when trying to enroll in programs. And it's great to see work that tries to untangle some of the factors that contribute to program participation. So in these remarks, I'll summarize some key points from the paper, discuss contributions that the paper makes, and provide some suggestions as you move forward with the work. So this paper examines relationships between various indicators of safety net program participation and design and administration, and program participation among low-income Latino or Hispanic households with children. The programs you consider include TANF, which provides cash assistance, SNAP or WIC, which provide food or nutrition assistance, and Medicaid, which provides health insurance coverage. You make a case for focusing on Latino or Hispanic households with children, given disproportionately low program participation rates among this group. A relatively substantial evidence base explores drivers of low take-up rates among this group, which can range from language barriers experienced during the certification process to fear and confusion created by anti-immigrant rhetoric and policies. Expanding on this evidence base, this paper links household program participation data from SIPP to a novel primary data source that includes policy and practice indicators. Preliminary findings from the full models that you presented suggest that more frequent trainings for frontline staff were associated with higher odds of program participation among Latino or Hispanic households with children. This relationship is consistent whether you consider any program participation or participation in TANF or SNAP only as the outcome. And this is one of the only associations that is robust to different specifications where you have your other model that is simpler and includes just frequency of trainings as a predictor, including some covariates at the household level. So this, as you presented this morning, higher frequency of trainings might mean that staff are better informed when interacting with clients, which may help clients enroll in programs, meaning that fewer people are falling through the cracks. And this might be especially important given changes in program eligibility rules and staff turnover. Results differed for non-Hispanic households with children, as you mentioned, suggesting that the two groups may respond differently to policies and practices that either encourage or deter program take-up. Some of the paper's contributions relate to its conceptual framework and data sources. So the conceptual framework unifies a few different frameworks, which you outlined earlier, and this allows for filling in gaps that any one perspective may have. This unified framework informs your analysis where you consider not only ordeals and administrative burdens, but also psychological and cognitive burdens that may affect program participation. The two data sources you use to conduct this analysis each contain rich information. So on one hand, you have data from households to inform your outcomes, and on the other hand, you have data from program administrators and frontline staff in 11 states to inform your explanatory variables. And even though this conference and this session are focused on SIPP, I think it's worth highlighting use of your primary data source, the Social Assistance Policies and Hispanic Family Survey. This data source provides a window into on-the-ground practices that other existing data sources, which collate information about state and local level eligibility requirements and business processes, might not. And throughout the paper, and throughout your presentation, you drew this distinction between de jure and de facto determinants of program take-up, and your ability to capture the latter with your primary data is a key contribution of this paper. I'd like to offer a few suggestions and along the way ask for some clarification on your approach. My first suggestion is related to framing. So currently the background section in the paper tees the reader up to understand that households may encounter barriers or facilitators to participating in a variety of safety net programs without necessarily identifying the specific programs considered in your analysis. It could be helpful to provide a high-level overview of the different programs that you consider, a brief description of eligibility criteria. Doing so could give readers a better sense of what it takes for households to enroll. It could also be helpful to know any major distinctions between programs that might inform your hypotheses, especially for the part of your analysis where you consider participation in any one program as the outcome. Related to this suggestion and distinctions between programs, I wonder whether the sample of administrators and frontline staff that were included in the survey that you conducted represented or worked across the different programs that you were looking at as your outcomes. So at least in some states, for example, SNAP eligibility staff work on that program alone and might not be cross-trained to conduct eligibility interviews for other programs. Also, WIC enrollment may happen through other agencies, for example, state or county health departments. So I ask about the sample because if you only have information from those, or if you primarily have information from those working on TANF, and the appendix that you shared with the survey questions seems to have questions that mainly focus on that program, then the predictors in your models may be out of alignment with your participation outcomes. And so my second suggestion is related to your sample of households. So you focus on households with children, and your justification for doing so appears early on in the paper. And you also mentioned that you selected states to participate in the survey based on where higher shares of Hispanic or Latino children live. It could be worthwhile to expand your sample so that you're not excluding other households like those with one adult or those with seniors. And if you decide to expand your sample, you could always present results separately for households with children. I recognize, though, that this suggestion may not be viable, especially if your primary data source, if your primary data focus mainly on TANF, which targets families with children. And before getting to my third and final suggestion about outcomes, I wanted to spend a moment commenting on the outcomes that you address currently. So you run 3 sets of models that consider participation in any public assistance program, TANF or SNAP only, and Medicaid only. Regarding the second outcome, I wondered about your rationale for grouping households who participate only in TANF or in SNAP, mainly because the programs might be administered very differently. So with that said, my last suggestion is related to taking greater advantage of what SIPP has to offer in terms of program-related outcomes. It could be worthwhile to explore other outcomes like reasons for program enrollment or discontinuation and participation spell length. Since it contains a level of detail that might not be available in other data sources, using SIPP provides some space for looking at outcomes beyond participation. So based on the next steps that you shared, it seems like you're heading in a very promising direction with this work and that you have access and are compiling some other interesting data sources. So with that, I'll close and thanks so much for the opportunity to discuss this paper. Thanks.
Great, thank you, Mahreen. Great suggestions. I'll give Luis a chance to respond to them in a minute, but first I'll pass the mic over to Liana to give comments on Tapas's paper. So Liana, the floor is yours.
Thanks, Zach. So I'll be presenting topics, or I don't know if you prefer Dr. Paul, Dr. Paul's paper. And thank you very much for the opportunity to read this and look at the impact of married women's labor market participation on poverty. Next slide. So just an overview of the paper. So this paper examined poverty rates for opposite sex, prime age married families by employment status of husband. So it is necessarily limited to opposite sex couples, prime age 25 to 54. I think there are good reasons to limit the analysis to these folks, especially if you're looking at trade-offs between employment status and official poverty. Of course, they have to be married to be in the same family unit. The supplemental poverty measure has a more inclusive resource sharing unit. So with the SPM, I saw the comment in the chat about unmarried couples, so they would be included in the same resource sharing unit. So this paper looks at descriptive time trends from May 2008 to August 2010. I think that the descriptive analysis is really the most valuable part, so we can see changes month to month in poverty status, both with official and SPM. Then Dr. Paul does a Kitagawa Oaxaca blinder decomposition, just adding in Evelyn's name here for her credit. But so I think the decomposition is valuable in that it shows the growing importance of women's earnings in the later part of your sample compared to the earlier part. So the analysis was primarily focused on official poverty, but also talked about SPM. And finally, this paper's already been published, so congratulations. I will focus my comments primarily on extensions because this paper is already done. Next slide. So the real key contribution here is to highlight the importance of women's earnings in reducing family poverty during the Great Recession, especially in situations when the husband is either unemployed or out of the labor force. The main finding, looking at both the descriptive and the decomposition, is that women's earnings cut family poverty rates in half overall. And there was a larger impact for families with an unemployed or not in labor force husband. Next slide. Okay, so this is a slide that Dr. Paul already showed us. But I think what's important is also, it's hard to see with the scale because we have such high poverty rates when we exclude families with unemployed husbands and excluding their wife's earnings as well. But what you can see on the bottom line is this is the all families, the blue circle. Poverty did increase over the time period from 8.2% to 10%. And if you were to exclude women's earnings, poverty would have increased by a larger amount from 17% to 20.1%. So it's really, including women's earnings, we have an increase of poverty of 1.8 percentage points. Excluding women's earnings, we would have seen an even larger increase of 2.9 percentage points. Next slide. So shown another way, so I really like this where you're actually just doing subtraction here and showing the impact of wives' earnings. And so here you can see this blue square line, which is again the total impact, and that's around 10%, a 10 percentage point reduction in poverty, which is where I'm saying it's about cutting poverty in half. Next slide. Okay, so since this is already published, just comments on future extensions. One thing that I really would like to see is to have you utilize the longitudinal nature of SIPP. So you're looking at each month separately and there's pooled analysis, but really what I wanted to know is that those transitions. So when a husband transitioned out of employment, either into unemployment or out of the labor force, did women's labor force participation change? Did their work intensity change? How do we see these reactions? Because you motivated the study by talking about how women's earnings played an insurance function. But looking at the history, I think women's labor force participation was pretty constant throughout this period. So I'm curious, were they making changes on the intensive margin? Were they working more hours? When their husband lost their job or left the labor force, what did we see there? And I know you also had some supplemental analyses where you looked at earnings over time, women's earnings, and those were fairly constant if I'm remembering correctly. So it's not that they were earning more over the time period, it's just that the husbands were working less. I wanted more about the volatility of poverty too. So how much are those families that are in poverty just constantly in poverty, or are we seeing people transition in and out? How volatile is that? as well as how volatile are the employment dynamics. Are we seeing in this man session, are we seeing men leave the labor force and then out for 6 months, 8 months, or are we seeing people come in and out? So I really wanted to really utilize the longitudinal nature of SIP to get at some of those dynamics. Also, I wanted some more descriptive statistics. So you have some pooled statistics, but not by month, and I understand 28 months is a lot to try to present that, but something more about how women's employment changed over this time period, both for within your sample, which is more restricted to the prime age, married women, but then also how does this compare to trends that we see overall for women's employment over this time period and men's employment? So are we a more selected group because we're looking at the folks who are married versus unmarried folks who maybe had higher or lower labor force participation? Wanted to see more on this part-time work, seeing how much people are increasing or decreasing their intensity. So men could be falling from full-time to part-time, or it could be low part-time or high part-time. And so women's earnings seem to have a more important effect, even if the men are employed, but not employed full-time. I'd also like to see some breakdowns by the presence, the number and age of children, knowing that the ability for both parents to be in the labor force is a little harder when you have below school-age children. Also, I think there should be some more analysis looking at race and Hispanic origin to the extent that you can do in the sample. Just looking at knowing historically higher rates of female labor force participation for certain groups. Next slide. So then you've hit my wheelhouse here. So I work a lot on the supplemental poverty measure. So I just had some comments on creating the SPM in SIP. And so I think this is what I got from your supplemental materials, but please let me know if I've misunderstood them. But I think that you're missing several of the key components because you said they weren't available in SIP: housing subsidies, work expenses, childcare. So in the 2008 panel, those are in topical modules and you can link them. And you can definitely estimate the number of dependents under 19. So I think that you're basically zeroing out EITC, which would be really important here for this analysis. But the good news is they are all there. All these questions that you'll need are in the SIP, and they're much more accessible now with the redesigned SIP. So I'll go to the next slide. Okay, so this you can't read, but just know in this report here by Kathy Short from 2014, she details exactly where you can find the different variables, both in the pre-redesigned SIP as well as the redesigned SIP. And so there's just all this documentation here. There's a link. I'll make sure to get you these slides. But all these pieces are available. I can tell you it's effort, right? Like it's not super easy. It's not a low-hanging fruit, but you can certainly bring them in. Some of our best measures of work expenses come from SIP. So I'd love to see you be able to incorporate that. Next slide. And then I'm just pointing you to some of our working papers that we've done creating SPM in SIP. So if you're doing 2008 SIP or earlier, you have to connect topical modules, and these two working papers talk about how you would do that. If you're using the redesigned SIP, all of the questions for the topical modules are asked in all of the waves, so you have all the information. It's a lot easier in that way. So you don't have to connect whatever different time periods. You get every piece of information there. So I'd really love to see you take this and extend it, especially if you're looking at the COVID-19 pandemic or over other time periods, to see how this holds up in that time period. And I think that is it. Otherwise, thank you so much for a great paper.
Great. Thank you, Liana. Thank you, everyone, for 2 great papers and 2 great sets of discussion comments. I'll open the floor at this point to the chat. I think Greg is going to turn on the raise hand feature so that if you want to ask a question verbally, you're able to do that. I know we have 1 question or maybe 2 to field from the chat that are already going as well. In the meantime, maybe I'll give just a couple moments to Luis first and then to Tapas, Dr. Paul, while people are thinking through any questions they might have to react to the discussant comments. I know both discussants asked some clarifying questions. If you want to respond to those, now would be a great time to do that to kick things off discussion-wise. So maybe Luis, I'll pass the mic to you first if you want to say anything in response to what Marina offered this morning.
Sure. Let me just first address the question in the chat, which was, how did you define a Hispanic family for families where not all members reported the same ethnicity? So right now we are basically, we consider a Hispanic family any family in which either parent may have said or may identify as Hispanic. I think this includes also single parent families. And the only other thing that I'll say is that we are also thinking about doing sensitivity analyses. So we will try to look at, Hispanic families where both parents are Hispanic, families where one parent is Hispanic and the other is not. And we'll just see what the results look like that way. As for the comments, Maureen, thank you so much. Those were all really insightful and helpful. I think the only question that I heard, and if I missed a question, please let me know. But it was about why we combined SNAP and TANF in as one of the outcomes. Yeah, I mean, I think point well taken about just how they are implemented. I think we were thinking that if like a lot of the families that receive TANF are also eligible to receive SNAP, and then also that these are children focused programs. So that was kind of the thought process there. And Medicaid is just a completely different beast. So that's why we put it separately. The idea being that given different eligibility requirements or stuff, we might see some effects on SNAP and TANF and not in Medicaid. So that was kind of the thought process there. But yeah, I mean, you're totally right about just how some practitioners may not be cross-trained for like both or like many of these programs. And by the same token, I guess we were thinking that some of these are cross-trained. So I think maybe it would be useful for us to go back to the data and see if we can kind of tease apart which programs these people are working with, these practitioners, and maybe that would be useful, yeah.
Great. Maybe I'll pass it over now to Dr. Paul. I don't know if you want to offer any comment on what Liana had to say.
Yeah, thanks, Jack. At the same time, thanks to Liana for taking the time to review the paper, to read the paper, giving your valuable time to this one. And as you said, like you want to see to extend the paper, certainly I would be more than happy. And currently, I'm planning to extend the paper in terms of to address the recent data, recent SIPP to that one. At the same time, having said this, the points that you mentioned regarding the supplemental poverty measure, I agree with you. When I did this analysis of the cases, what happened, like the factors or the components that state needs to be included, the data set either that are mostly unavailable or the sample size, like the families I was considering, those they were not receiving money in terms of those components. I believe that was the case, but certainly I will take care of this to my next one, the extension part here. So this is all about from my side, Jack.
May have lost Dr. Paul's video, or is it back for audio? There we go. Is there anyone? I think I'm keeping an eye on the chat here. I'm keeping an eye out for hands. I don't see any hands at this point. I don't see any comments in the chat that have been unaddressed. Panelists can correct me if I'm missing any. I'll just give people one more moment if they have anything that they want to ask or add to the conversation here. Liana has a hand up, so let me pass to her.
All right, I'll just jump in while other people are putting their hands up. I had a question for the first paper. So when you were looking at the total number of co-located services, I believe you showed that there was a high rate of non-response on that component. Maybe that was around 40%. I was wondering what you did with missing. Did you impute? Do you just omit them? Because I'm wondering, there was a strong positive association between the number of co-located services and receipt, but then also the high non-response. And then when you put it all together, then it wasn't positively associated. And I'm just wondering how you were dealing with the missing.
We actually right now, that's actually something that we realized like maybe last week. So we have yet to deal with it. You're totally right. I think it is like 500 observations or something. So we still need to think about how to address that. But currently we're not really doing anything. So I think for that, maybe that would be one of the regressions with the lowest number of observations in it. But yeah, no, that I also saw that and was very curious about what it meant, but then saw the number in there. So yeah, we'll have to look into it. But yeah, thank you.
Any other last burning questions before we wrap up here? I'm not seeing any hands. Chat looks quiet. So with that in mind, I'm going to go ahead and thank Dr. Paul, thank Luis, and thank our census discussants for their comments. I think this is a great session to kick off the first oral session of this conference. I know there's lots more great sessions the next 2 days, some of which touching on topics relating to these. Oh, but just as I do that, maybe I'll give Luis a chance to answer Holly's question. I'll read it aloud. Did you pool 2019 and 2020 SIP? Is it possible you included any of the same families in your sample, or check whether families move between years, since data is essential to your analysis? So let's cover that before we close out here.
Yeah, yeah, we did pool 2019 and 2020, and there are some of the same families included. That's why the unit is family year, but it is not that many, if I recall correctly. And also, about the families moving between years. Yeah, man, I will actually have to look back at that because I cannot remember which one. I believe we used 2019 as the reference year, 2019 as the state, because we collected data in 2019, but I actually don't remember correctly. So thanks for that question, and I'll actually go back and look at that. Thank you.
Great, thanks for that. And then also a question for Dr. Paul from the chat about where we can find this published paper, and he's put a link in the chat to that. So if you want to get the full results and supplemental materials, they can be found there. On that note, I will make sure presenters that you get the slides concatenated with discussant comments, so that some of those materials that Liana was referencing will be available to you. Otherwise, at this point, seeing no further comments, I'll give everyone a little break from WebEx for a few minutes before the next session comes along. And I hope you all enjoy the next 2 days here at the SIPP conference. And thanks again for attending this great session. And thanks to the presenters and discussants.